Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. And indeed it is. We're coming to you live from the Scottsdale Airpark Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And we're also podcasting now, so if you have your favorite podcasting app, please download us. We ask you to like us, leave us a review, and more importantly, recommend us. So if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening to the show, but not to me, but to these extraordinary guests that I get to come to the show. And today's no different. I have Dr. Anna Burke here in the studio with me. It's been a little over 4 years. She's the Director of Alzheimer's and Memory Disorders Division over at the Barrow Neurological Institute, and the Carson Solheim Chair for Dementia. And for us golfers out there, we know what Carson Solheim stands for. But without further ado, Dr. Anna Burke, welcome back to Health Futures.
Thank you. It's great to be here.
It's amazing it's been this long, and a lot has happened in this journey that we've been on. And I might say, I met you when you were at another institution, and I met you when you just moved here. And I'll never forget, I was in this board meeting, and you got introduced, and you spent a few years there, and now you're over at Barrow Neurological Institute, really making a difference in a lot of the lives that you serve.
Yeah, I've been in the Valley since 2008, but at Barrow for about 8 years now, almost 8 years.
Yeah, time flies.
Yeah, it does. Really.
It flies when you're having fun.
It does.
But I think the thing I really admire about the work that you do and other physicians and doctors and scientists do on this work, this is probably the most important work that is needed in our society. I mean, this is the moonshot. We've got to figure out how to stave off this disease called Alzheimer's.
Well, we're all aging, and unfortunately, that's one of the greatest risk factors for developing Alzheimer's disease. So the longer we live, the more likely it is we'll develop this disease, and finding ways to stave it off, ultimately to cure it, is our goal.
Well, we've learned a lot, and I'm a lay person, but I know enough to be nice to be dangerous. But I will say this: I mean, one of the things that we do know, and maybe you can speak a little bit to it, is genetics. Genetics play a big part of this.
Yeah, genetics definitely does play a role. But keep in mind that about 40% of risk factors for developing Alzheimer's disease are actually modifiable risk factors, so not genetics, things that are within our control. Now, we can talk a little bit maybe about what risk factors there are for this disease.
Yeah.
So first of all, you mentioned genetics. So let's talk about the non-modifiable risk factors. Having somebody in your family who has had Alzheimer's or related dementia certainly increases the likelihood that you're going to get dementia or Alzheimer's disease. Having a certain genetic variance, like the ApoE4 allele, increases the likelihood that you will develop Alzheimer's disease. But again, it's not a guarantee, it's just a risk factor. There are rare genetic variants, rare mutations, like mutations in the presenilin 1 and 2 genes, the amyloid precursor protein gene, but those are fairly rare. They constitute less than 10% of all Alzheimer's cases. Being a woman, unfortunately.
I know, right?
Yeah, those 2 X chromosomes increases the likelihood of developing Alzheimer's disease.
And 2 times versus men, right? It's 2x.
Yes, so about 2/3 of all Alzheimer's patients are women, and 2/3 of all caregivers for patients with Alzheimer's disease are women. So
that's the
double
perfect
whammy.
storm.
Yeah.
It really is. I mean, and I know this from the home care world. I mean, the primary person that is caregiving or directing caregiving in a family or for their parents is usually the eldest daughter. It's usually the daughter that's doing this.
Typically, and typically caring for her own family as well.
Right.
Young children oftentimes, plus the parents. It's the sandwich generation.
100%.
But those types of risk factors are only a part of what increases the likelihood of developing Alzheimer's or other types of dementias. 40%, again, of all risk factors are modifiable, so within your control. And these are things like diet, exercise, lifestyle, controlling certain medical conditions. So, for instance, did you know that if you have uncontrolled hypertension as opposed to controlled hypertension, your risk goes up by about 10%.
Wow.
Having diabetes increases the likelihood of having Alzheimer's disease. High cholesterol, traumatic brain injuries. Certainly our diets, the typical or standard American diet, as we call it, the SAD diet.
Yeah, the SAD diet.
That's what we call it, the SAD diet, the standard American diet.
What a great acronym.
It is horrible for your brain and increases the likelihood of developing Alzheimer's disease. Our lifestyle, the fact that we're not moving, we're sitting around watching TV, increases the likelihood.
Yeah, the binging TV, not good.
And then we're not stimulating our minds. So we know that cognitive stimulation, being able to do, whether it's reading or doing brain games or crossword or jigsaw puzzles, all of that challenges your mind. It helps to build neural connections. And the more of these connections you have, the more neuroplasticity you have, the more likely it is that even if you have these sentient changes, these changes in your brain that start to chip away at your brain health, information is still going to be able to get around, and you're going to be able to compensate for some of those losses and stave off the onset of dementia.
You know, one of the other factors, and you and I haven't talked about this, is the fact that we have so many people solo aging. You know, 1/3 of our population is living home alone, and it's projected between now and 2050 that number might encroach in 50%. And the fact that, you know, we are not having those human connections. You know, we are utilizing technology and texting and emailing, and however you're connecting isn't really a connection. Like being in the same room and having a dialogue and a conversation and being able to hold someone's hand and give them a hug or just put their hand on their shoulder. Those are human things that we need.
Absolutely. Absolutely. And social interaction has been shown to actually, again, slow the rate of cognitive decline. But what's interesting is it's not only social interaction with our families, it's social interaction with peers, because you behave differently when you're interacting with peers, right?
Yes.
You're engaging different parts of your brain. You're stimulating different neural connections. So this is where things like social clubs, adult day programs, senior centers come into play.
100%. You know, we're getting ready to end the first segment. If you recall, they go really fast. But, you know, one of the things I do want to talk about in the second segment here is really the family caregivers and the need for support groups. the need to talk to peers that are doing the same work that you're doing, because oftentimes these family caregivers think they're all alone. And I think it's estimated there are about 15 million of them out there caring for a loved one that has dementia or Alzheimer's, and they need that kind of support. So we're down one. We got 3 more to go. I got Dr. Anna Burke here in the studio with me. She's from the Barrow Neurological Institute. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. If you're just tuning in, we're in our second segment here. I got Dr. Anna Burke here. She's in the studio with me, and she is with the Barrow Neurological Institute, and we are talking dementia and Alzheimer's. If you missed that first segment, go up to our website, cypresshomecare.com, click on the media button right below its radio show. You'll catch this one and many, many more. So when we ended the first segment, we were talking about, or at least I led in talking about support groups and talking about the family caregivers, and there are about 15 or 16 million of them out there that are caring for someone that has dementia or Alzheimer's. And we said at the break, I mean, technically we don't really know how many people are out there, because there are a lot of people that have it that have not been diagnosed. And one of the things I run into all the time, Anna, is that I run into couples where one just covers for the other. And then the realization that that parent that has the dementia or Alzheimer's isn't realized till the healthy partner, as I described, 63% of the time they pass when they're not getting assistance. Then the children are like, oh crap, right. You know, mom or dad is really in a bad shape, and they didn't know because the other was covering for them.
Right.
You probably see that a lot.
We see that all the time. And oftentimes what families will write off some of the subtle changes that they are seeing as is stress.
Right.
Mom's a caregiver. She's stressed. So we thought it was pretty normal that she was repeating herself, or that she was forgetting what we were saying. Maybe she wasn't focusing on it.
You know, and we did leave off talking about support groups and the importance of support groups. You know, can you talk a little bit about that? Because I know that at Barrow you run them, but they're run through here, through the valley. We have these memory cafes that are around. I mean, it's really important for these family members that are doing the hard work to connect with others.
It is really the main reason that patients seek us out at Barrow, because we do have those additional supports. As I like to say, most centers in the area, if you're lucky to find a good neurologist, oftentimes they function in what we refer to as kind of a diagnose and adios mentality, right? You come in, you get your diagnosis, your workup, you get your prescription, and then it's like, I'll see you in 6 months. And most families then are really left just struggling. They're searching for answers. They're trying to figure out, what do I do? What do I avoid? Oftentimes they're doing things that make the disease worse, or their own stress as a caregiver worse. So being able to support them after that diagnosis is made is really important. And we have something called a cognitive health advisor team. So this is a team of social workers and nurse specialists and allied specialties that once we as physicians make a diagnosis, they swoop in and they help the care partner to figure out, okay, what do we do now with this chronic illness? So they have online support groups, they have educational programs, they have videos, they have tip sheets and different topics. We have caregiver handbooks. All of this is available on the website. So if you want to go to barrowneuro.org/memory, you have a resources page, including the calendar of events, including some of the support groups. I would encourage people to take a look. You don't necessarily have to be a patient of Barrow to take advantage of this. A lot of it is free and virtual.
No, it's so important. It really is. You know, I'm going to ask you a question. So I have a friend of mine. I'm actually doing like an intervention after our show here today. So this is perfect. I mean, I know I'm kind of putting you on the spot. his dad is a patient of Barrow, of one of your colleagues, and his dad's a really smart guy. He's a doctor, and he's in that denial, and the adult child is having a hard time. He's agreed to sit down with me, so I'm going to be very pragmatic and really discussing what his journey's all about. And I know he's talked to the folks over at Barrow, but now it's more of a layperson, and I want to really be able to coach him through all this. Any advice before I sit down with them?
Well, it's about finding common goals, right? It doesn't necessarily, for many people, especially for people who have been using their mind all their life and where their intelligence, their ability to remember things is tied into their identity, a diagnosis like Alzheimer's disease or any other cognitive impairment can be devastating. So we protect ourselves from that devastating diagnosis in any way we can. But in your role as a care partner or in your role in this intervention, it's really about trying to figure out what are the common goals. I'm sure his goal is to maintain his memory for as long as possible, to be able to be as independent as he can be. And you have to figure out, okay, where can we meet? Maybe accepting a little bit of help initially will actually help you to maintain your independence, maintain your memory and thinking. We don't have to label this as Alzheimer's. We don't have to label this as dementia. It could be excessive memory loss.
Right.
I'm just dealing with that, and I am doing everything I can to manage my excessive memory loss.
And being a physician himself, he knows the journey. And I know that, like probably for me or for you, you're going to fight it all the way. But it's how do I get this person to be more of accepting and knowing that this is the journey I'm on, and I want it to be the best it can be. Because I can tell you for the adult child, it's just been, oil and water. I mean, they've been, and he's trying to help, but, I see this every day. I mean, when it comes to children and their parents, the parents still think their child is still 12 years old and doesn't really know.
We all do. My children will probably be 50 and they'll still be 5-year-olds to me. You're right. I mean, it is extremely difficult. And in some cases, there is nothing that you can say. There is nothing that you can do. A lot of my patients and their families come in frustrated and they wish there was this magical Jedi mind trick that I could do as a doctor to just all of a sudden improve their insight and their willingness. Sometimes you can't do that. And sometimes as a family member, you have to work around that resistance. So just putting supports in place, making sure that you're avoiding potential safety issues. Sometimes you have to be the bad guy, or you have to let your doctor be the bad guy.
Right.
So, for instance, conversations regarding driving, let's use that as an example. I can't tell you how many times I have families who come in and say, he's not safe to drive. So let the doctor in that case be the one who says, we're pulling the car keys. And you're just the family member on the other side saying, Dad, I can't believe this happened.
Right.
But you know what? We are going to support you every step of the way. That's usually when I get fired, but you can always find a different doctor.
Right.
You have to be the one as a care partner on your loved one's side. You have to be their team.
What's interesting is, having done this kind of work now, my family business is 31 years old, and I've been at it for 21 years. The I wouldn't say typical, but a lot of my patients or clients that we serve are just like this gentleman. I mean, they professors, doctors, lawyers. I mean, they're incredibly cerebral, smart people are getting dementia and Alzheimer's.
Oh,
it is amazing. I mean, when I sit down and look at people from the trades, it's much heavier for the professionals than it is for the trades.
I've treated incredibly intelligent people. I mean, CEOs of major companies, university professors, and presidents. It affects everybody. This disease does not discriminate.
Right.
Now, it may have something to do in part with our lifestyles, as I mentioned. All of us are being exposed to different toxins in our food, in our environment. We're yet to fully understand those risk factors, right? I think probably as we're stimulating our minds, there is some protection there because of our higher cognitive reserve, but there may be other things that are balancing that out. I can tell you as a doctor, I spend long hours sitting with patients. I'm probably not as active as somebody who's in the trades, who is up and down and has actual physical work. How does that play into that risk?
Yeah, we're still learning a lot. And I know we're coming up at the end of the second segment. What I want to talk about in the third segment and beyond is really these new pharmaceutical drugs and these new clinical trials that you guys are doing. I do want to talk about these GLP-1s. I want to put that tease out there because everybody sees the television commercials. They know friends and family members that are on these drugs, and would love to know what impact or what early studies have you seen and its effect on the folks that have dementia and Alzheimer's and that are dealing with this. Other than that, I want to really talk about the future and where do you see us going? Artificial intelligence is like the big buzzword. People are scared to death of it, but we need to embrace it. It's amazing how long it took us to map out the human genome, and now we could have AI do it in a matter of milliseconds. So there's a lot of stuff that you're probably utilizing and doing, and the science side utilizing artificial intelligence. So I'm interested and eager to learn more about that as well. Okay. We got a little Paul McCartney taking us out. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Anna Burke here in the studio. She's from the Barrow Neurological Institute. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here. I got Dr. Anna Burke here in the studio with me. She's from the Barrow Neurological Institute, does a lot of work with dementia and Alzheimer's. I've known Dr. Burke now for about 17 years, and it's amazing to see your path and how you've done and what you're doing and how you're making a difference in not only the lives of the people you serve and the families that you serve, but Barrow Neurological Institute, you guys do a lot of research over there. And, I teed this one up talking about what's new. We talked about new drugs, the MABs, and, I teed it up talking about GLP-1. So I really would love for you to educate us in terms of what kind of research is out there, what kind of breakthroughs or potential breakthroughs that we're looking at in terms of staving off this horrible disease.
Well, there have been some breakthroughs over the past several years. For a long, long time, we have had absolutely failure after failure after failure in this field in terms of research. I was recently looking at my history on my CV, and it seems I've run over 100 different clinical trials over the course of my career.
Wow.
And looking back over the past 20 years, we really didn't have any new medications for almost 20 years until about 2 years ago.
Yeah, Aricept was like the that was like in 2000 or late 90s,
No, that
right?
was developed in the early 90s,
Early
93,
90s.
I believe.
Wow.
And the last medication to come out was memantine or Namenda, and that was 2003, I believe, was when it was approved, and then nothing until about 2.5 years
So
ago.
20 years.
Uh-huh.
Wow.
Almost 20 years. So we now have these monoclonal antibodies. So these are amyloid targeting therapies. These are antibodies that are actually infused directly into the vein. You typically have to come in for infusions about once every 2 weeks or once a month, depending on the agent that you're on. And these medications go up to the brain, they latch onto amyloid, and they dissolve amyloid. And they're highly effective at eliminating that amyloid.
So cool.
Yeah, almost all people in the clinical trials within a year and a half had full elimination of amyloid from their brain, to the point where if you looked at their brain scan, it didn't look like somebody who had Alzheimer's disease.
That's impressive.
Now, having said that, that doesn't stop the disease.
No.
Because we know there's more than amyloid that's likely damaging the brain. But it does slow it down. It actually helps to significantly slow how quickly people lose function, how quickly they lose memory, by about 30% on average. So imagine having 30% more time.
Wow. It's an eternity in that world.
Yeah.
Absolutely.
Well, the problem is these medications are only effective in early stages. So once you get past a certain stage, which is past the mild cognitive impairment or mild dementia stage, they're no longer effective. They're all risk, no benefit. So identifying this disease early is really vital.
And we talked about it in the first segment about genetics. So, if I have parents that had APOE4 genes, if I had one copy, there's a chance I'm going to get it. If I have two, and then there's even a greater chance. Do I, or anyone that's listening here that may be, in that type of circumstance, should I be seeing a neurologist and be, is there some preventative studies that I should be involved in? I mean, I know that a lot of people are scared, but at the same time, with these breakthroughs and stuff like this that can dissolve tau's or dissolve the plaques, the amyloid plaques, that's big.
That is big, but these medications are not yet approved for prevention.
Okay.
So you have to be symptomatic. You actually do have to have memory symptoms in order to qualify. And you do have to have that amyloid buildup. Now, we know that amyloid buildup occurs about 10 to 20 years before you start to show clinical symptoms. So there are research projects right now. There are studies studying these medications along with a whole host of other medications for prevention. We don't have the full details on that. Those studies are scheduled to read out over the next few years. But if positive, we likely will want people coming in earlier if they have a family history.
Right. It's amazing. It really is. And, I if you could just speak for a minute or two and talk about Barrow. I mean, Barrow Neurological Institute it's exactly that. It's an institute that people come from all over the world to. You got kings and princes and presidents of whatever. They're coming here for treatment.
It's truly a well-hidden gem in Arizona, and it's one of the best neurological and neurosurgical institutes in the world. So we do have people flying in from all over the world to receive care. We have a clinical team, as I mentioned earlier in the broadcast. We don't believe in diagnose and adios. So while we have amazing specialists that will make sure that you have the right diagnosis, if there is something happening, that you're on the right treatment, we also have this cognitive health advisor team that will then help you manage the disease from a non-medication standpoint, help you as a care partner to help your loved one. We will look at your diet, your exercise, your lifestyle program, and make some recommendations. But we also assess whether patients are actually candidates for clinical trials. And we have a very active clinical trials program. Typically, we will have about 20 different clinical trials that are active at Barrow. Now, some of them are treatment trials. Some are trials to develop new technologies for better diagnosis. Some are just longitudinal trials where we follow people over the course of their lifetime and we learn about how their brain ages. So there are opportunities always to enroll.
Right.
And you don't have to be a patient of Barrow's in order to actually enroll in one of these clinical trials.
That's good to know. It's good to know, and I know that you gave out the website before.
Yes, it's
barrowneuro.org
barrowneuro.org/memory.
/memory.
And you can learn a lot about our different programs, including our clinical trials.
All right, so I know these segments go fast. Let's talk about GLP-1s, because that's like the big thing out there. You know, I see those commercials for Ozempic and others. Are you doing some studies with this?
So we are not, but there are studies that are being done with semaglutide, which is Ozempic. So these are the gift that keeps on giving, as I like to say. These medications were initially developed for diabetes, but we have found that they do so much more. For instance, they seem to be effective for sleep apnea. They seem to be effective for depression. They're now being found to possibly have positive effects on dementia. So, for instance, patients who were on these medications for diabetes, we were starting to notice that they had lower rates of developing dementia.
Wow.
That led to clinical trials specifically for dementia called the EVOKE and EVOKE Plus clinical trials that are ongoing and anticipated to show results by the end of the year.
Fascinating. And you and I talked during the break. Addiction, too.
Addiction, too.
And they're starting to show positive effects on addiction. It is a very interesting drug that's been around for like almost 20 years for people that have had diabetes. So it's
not without side effects, but fairly safe.
Right.
Like you said, we've had it around for a while and generally pretty well tolerated. So potentially it could be a new treatment for this disease and possibly for prevention in the future.
You know, one of the things that I learned a long time ago, and it was from one of your colleagues, and that is plaque in the heart, plaque in the brain. And you mentioned it early on the first segment. Movement is such a big part of what we need to do. Exercise, the food we eat, you know, getting our cholesterol down, all of those things are benefiting and staving off the possibility of having dementia or Alzheimer's. Well, you hear the music. We're down 3. We got 1 more to go. You know what I want to talk to you about in the 4th segment? I've been reading about blood tests.
Huh?
I want to hear a little bit about blood testing, you know, for seeing if you are or have a propensity to get dementia or Alzheimer's. Got a little Marshall Tucker taking us out. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Anna Burke here. We got 1 more segment. Stick around. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our 4th segment here. I've got Dr. Anna Burke here from the Barrow Neurological Institute. We're talking dementia, Alzheimer's. If you missed those first 3 segments, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So I left the 3rd segment off about this blood test because I'm reading a lot about it. And it's making a lot of news. And certainly I know I have questions, and you probably do too, and many people that are listening do as well. So can you share with us what this means? Is this a game changer for us to know if we have this disease or a possibility of having this disease?
I think it truly is a game changer. So for many, many years, Alzheimer's disease was really a clinical diagnosis. We really didn't have good technologies or affordable technologies that we could use to confirm the diagnosis. So it was just how skilled your doctor is at picking up patterns in the history that you give them, in the cognitive testing, and so on.
I've been doing this so long that I remember in the day, they said the only way you could validate someone had Alzheimer's was during the autopsy.
Yes. Well, it's still, technically, it's still the gold standard. It's still 100% certain.
Right.
But the blood tests and the additional tests are getting more and more accurate. For instance, the blood tests that are currently out there, like the p-tau 217 test, which is a very simple test to do. It's a blood draw and you have results within a week. It's 93% accurate.
Wow.
Mm-hmm. Yeah. So we can do a blood test, and that blood test basically tests for proteins in your blood that correlate to amyloid buildup in your brain. And we know, again, that amyloid builds up about 10 to 20 years before you start to show clinical symptoms. So this could be a game changer where potentially in the future, when we do have prevention therapies, we could do a simple blood test as part of your regular workup with your primary care physician. If that blood test is elevated, well, maybe you need to see a specialist. Maybe there are medications that can actually help stave off memory loss.
Wow. That's fascinating. And even if you do test positive 93%, I mean, you talked about it in the first segment, it's lifestyle.
Right.
I mean, all of a sudden, you're like, I'm not going to fast food anymore. I'm just going to start eating healthy. I'm going to start taking care of myself because I know I may have the propensity to get this. And delaying it by changing your lifestyle is a big part of that.
Well, I'm sure it'll be a motivating factor for many people, but I think our lifestyle should be modified no matter what, right? Whether you have the family history or not. Because your lifestyle, your diet, all of that affects so many different diseases. And keep in mind that Alzheimer's disease is only a single type of dementia. There are other types of dementias you can get.
Right.
You can get vascular dementias, and those are very highly tied into blood flow issues, so into heart disease and hypertension and high cholesterol. You can have strokes. You can have all kinds of other problems.
You also could have Lewy bodies.
Yes.
Which is, if you want to share with our audience a little bit about Lewy bodies and what's it, FTP or frontal lobe?
Frontotemporal dementia, or FTD. Yes, so in terms of dementias, dementia is an umbrella term, right? It just means that there's cognitive impairment that's affecting function. And under that umbrella, you have different types of dementias. Alzheimer's is the type of dementia. It's the most common type, accounting for about 60 to 80% of all dementias. But then you have these less common types of dementia: vascular dementia, Lewy body dementia, frontotemporal dementia. All of them are somewhere between 2 to 5% each of all dementias. Now, Lewy body disease or Lewy body dementia is a strange beast because it has certain features of Alzheimer's disease, like the memory loss, but also certain features of Parkinson's disease, where people start to develop these Parkinsonian symptoms like hunched posture. Their facial expressions become more flat. They may develop tremors, gait changes. They may actually start to hallucinate, see things that aren't there. And it tends to fluctuate a lot, where they have really good days and then these really bad days when they're confused. Frontotemporal dementia is another rare type of dementia. It tends to present in younger individuals, although you could be older in developing it. And it tends to present less with memory issues, so not a typical presentation, but rather more with behavioral changes, personality changes. People start to, their insight, their judgment starts to deteriorate. Their social graces may deteriorate. They become more impulsive. Paranoid certainly can become paranoid. It's and sometimes they can start to have really prominent language changes as well, where they have a hard time expressing their thoughts, being able to formulate sentences.
Wow. I mean, there's a lot out there. And, I know that, we can talk about the doom and gloom, but we did talk about in the third segment the hope and the clinical trials and the work that you're doing. As we get ready to close our show in the last 2 or 3 minutes here, is there a question I haven't asked? Is there a message, an underlying message you would like to leave to our listeners here about dementias and Alzheimer's and where we are today in 2025 versus where you were 25 years ago when you first started in this field?
Well, I think we're in a much better place. So there is hope. I think that's the main message. And I think if there was anything that I would add, it would be that the future looks brighter. There are over 140 different clinical trials of different agents right now, everything from repurposing medications to novel agents to these prevention trials. I think where the future of dementia lies is really in prevention. So we're going to see over time that you're not going to be coming into a memory disorders clinic with symptoms. You're going to be coming into a brain health center.
Ooh, I like that.
Yeah.
And the thing I like about what you described at Barrow is it's not, diagnose and adios. You talked about the team that exists there for those families. Can you share a little bit more as we close? If I came to see you and there was a diagnosis, what would my journey look like with Dr. Anna Burke and Barrow Neurological Institute?
Well, after you met with me, after we established a diagnosis and a medical plan, you would get an email from my team saying, hello, this is the cognitive health advisor team. We'd like to invite you to an introductory session. That introductory session is a virtual session where we go over all of the supports and the education and everything that you can take advantage of just to help you navigate what we have and what might be the right fit. And then you'd be invited to join some of the support groups, whether it's for Alzheimer's or Lewy body disease or frontotemporal dementia. We have all of these different support groups. We even have a Spanish-speaking program, realizing that it's sometimes easier if English is not your primary language. You would be then, if you needed some additional support, let's say you're trying to figure out how do I manage like the legal and the financial issues, right. You could have a one-on-one session with our social worker who could help you navigate that.
And we're here in the summer. I mean, travel, How do I take my dad with me, or how do I take my wife with me,
We have a special segment on the website specifically about travel, actually done by our colleague, Jan Doherty.
I love it. She's been here on my show, Travel Alls.
She is the travel guru. So she actually did a video series for us on the website.
I love that. I really do. As we close, I talked a little bit about artificial intelligence and machine learning. That's got to be such a big factor in the research and the development of these drugs and therapies to really help prevent and stave off this disease.
Yes. So actually, we are doing a clinical trial right now with primary care physicians to hopefully help them with early diagnosis using AI technology, digital cognitive assessments.
Ooh, I like that. Because I've heard that, you can do it with voice, you can do it with eyes. There's ways to be able to see some of these signs. So.
Absolutely. That is the future.
Dr. Burke, I can't wait another 4 more years. We got to do this on a more regular cadence. It really is fun to have here in the studio. Really talk about not the doom and gloom, but to be optimistic about the future. This is, I believe, one of the biggest problem solves of our generation, if not humanity. And you guys at Barrow Neurological Institute are on the front line doing it, and you're doing great work. Thank you so much for being here, and thank you for the work you do.
Thank you. Thank you.
Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.